I'm Dr. Cowles from MD Anderson Cancer Center in Houston, Texas. Our abstract looked at whether or not you could gauge operating room fire risk assessments directly correlates to operating room safety culture. We know that several things, such as surgical patient checklists, are used as a metric for safety culture within the operating room. But some people doubt the validity of these checklists, and some people think that the Hawthorne effect can make true assessment very difficult. We chose surgical fires because although they're a rare occurrence, they're an event that nobody wants to occur. They can be nearly 100% preventable. They can be done so at very little cost to the facilities. It's basically where the facility puts their priorities. We sent out surveys to several hospitals within the U.S. We had a return of 82 surveys. What we found out was there was a statistical correlation with facilities that did, prior to a procedure, assess the fire risk at the highest level of safety culture. We also found out that those that didn't have education or do a procedure had the lowest perception of safety culture. We looked at, in our survey, we looked at areas such as respect, management, climate, and what the top priorities of the institution were. We also looked at whether or not that they did fire safety education. We also looked at whether or not this was discussed in the timeout. We found out that the lowest rate of response was the ambulatory surgery centers, and they also had the lowest degree of a safety culture. We know that further evaluation is needed to pursue this and to place a better correlation, but certainly it is maybe a cheap and easy way of assessing the safety culture of institution. Thank you very much.